What's up, everybody? This is Josiah. I want to talk about the hormone testosterone. It's produced in both men and women. Men produce it about 10 to 15 times higher, comparing blood in both men and women. It is an important hormone for well-being, so I want to discuss this a little bit. Women produce about 25% in the ovaries, 25% in the adrenals, and about 50% in circulation. The predominant place of production in men is the testes, and we'll talk a little bit about why it's made, what we can do with it, how we can improve it, and some other statistics. But why it's important? Well, sex drive, obviously humans are sexual beings, so this is a big part of life. Muscle mass, so keeping our muscles healthy, being able to get through life, do what we need to do. Bone density is closely related to testosterone levels, especially in men. We'll show some statistics for that. Our energy level, combating fatigue so we can get things done, and in preventing depression. This is a huge thing in men. Low T can result in fatigue and depression, and so we'll talk a little bit more about that. So as far as when it's peaking in men, I'm going to concentrate on men. There's a couple studies here that discuss this, and what they have found is this is a circadian rhythm type thing. So here's 8 o'clock in the morning, 8 o'clock in the morning, and you'll notice that both in young men and older men, there tends to be a peak of testosterone around these times. Now this relates to morning wood or erections that should be present, as we can use as an indirect indicator that you're releasing testosterone appropriately. Now older men tend to be more flat, but there is still some peak around 8 a.m. So sleep is huge here. If we're not sleeping, we're not getting peaks. And so that's something to consider and keep in mind. So this is some graphs on bone density and treatment with testosterone or a placebo for 12 months in this study. So we're comparing the spine here and the hip, the density, and the dark area are testosterone added people versus placebo. And so essentially, if you look at the bar graph, the change from baseline, we're getting anywhere between 4 and 8% peaks in testosterone at the bone density of the spine. And in the hip, we're getting about almost a 2% increase over the placebo here. So we definitely know testosterone plays a role in bone density, and so that's another important consideration. So this is a study concluded about basically how our body weight and age affects testosterone. So the green is the BMI of less than 25, which is what we consider healthy. The blue is BMI 25 to 29, which is overweight, and a BMI of greater than 30, represented by black, is obese. And so we can look at the testosterone levels performed. This is total, this is free testosterone, and they do include age here, so from 40 to 79. And what we can see is total testosterone in a healthy weight is definitely higher than what we see in the obese. And we're not talking about a small difference, we're talking fairly large. In total testosterone checking, in family practice that I've checked it, people that are overweight tend to have much lower total testosterone and even free testosterone than men who are healthy weight. So if you look at this is free testosterone here. So we see the green is the healthy weight and the black is the free testosterone. Now obviously free testosterone decreases no matter if you're healthy or not over age as we approach the 70s here. But notice once again, the black, the obesity is lower in both cases. Now, this is talking about luteinizing hormone, which is the hormone from the brain to the testes to stimulate. So you're still getting stimulation here of the luteinizing hormone, whether you're obese or not, to the testes. It's just a matter of whether we're making testosterone or not. And notice luteinizing hormone increases as we age. That's because the brain is trying to trigger the testes to make more testosterone, because it's a loop. So it goes the pituitary luteinizing hormone to the testes, that testosterone feedbacks on the luteinizing hormone. So if our testosterone is going lower, our brain is trying to signal the testes to make more testosterone. So we're going to see this inverse relationship. Now this is sex hormone binding globulin. So this basically is a circulating protein that grabs onto our testosterone and controls, regulates its levels. So healthy weight, we have a little higher levels of sex hormone binding globulin than those who are obese, here represented by the black again. And so that is because our testosterone levels are getting so low if we're obese that the body's trying to compensate that by not allowing the sex hormone binding globulin to be produced by the liver to allow our testosterone to try to normalize itself, so to protect us from having extremely low testosterone circulating, which would be pretty bad for men as they're going through life and dealing with those things that come up. Now, I just wanted to show a small chart on circulating testosterone fractions. So we have the orange here is our free testosterone. It circulates about 1 to 2%. This is sex hormone binding globulin, that protein I was describing, that binds up and holds on to testosterone to regulate it. So it's not, if you're bound by sex hormone binding globulin, it's not free and available to change the cell. So what we're concerned about is our bioavailable testosterone, predominantly the free hormone, which actually is a very low percentage. So we use the total testosterone, this range 350 to 1,000 in men, as kind of the normal total. Now that includes the bound and unbound. And then we use this around 50 to 200 or 1 to 2% of that free testosterone to figure out what is active. So bound hormone is inactive and free hormone is active. It can make changes. And so that relationship I showed you in the graph before, as the sex hormone binding globulin going down in obesity and being higher in non-obese people, because the testosterone is either there or not. And so the body's trying to compensate with that. So I wanted to show one more graph here on what happens to testosterone as we age. And you'll see that the total T over from 30 to 90 decreases. And sorry, this is the free, this is the total here. The total and the free both decline over aging. So it's a natural part of aging. Now, our goal is to try to prevent this from happening. And so I wanted to discuss a few things that we can do to try to help deal with this. This is what I've concluded from my time in medicine and what I've read. And these are things that we can do short of actually injections to help testosterone, to keep it high, to prevent our muscles from breaking down, to keep happy, to offset depression. And these are principles that can help us in many things in life and are time tested. So obesity actually is inflammatory. We know this. I put a little chart here. You'll see this. This represents fat cells. We decrease our testosterone from this. We know diabetes comes with obesity. It's very inflammation to the whole body. You can see this in central factors. This low-grade inflammation actually affects that circulation of that hormone, specifically luteinizing hormone, which stimulates the testes to make testosterone. So other things like sleep apnea are inflammatory because we're having a cortisol adrenal response all the time, and it results in low testosterone too. So the main thing, the number one thing that we can do is just get rid of our belly fat. So belly fat, something about it, the adipose tissue collected on the abdomen offsets testosterone. It just makes it a problem. The other thing that we can do to help with that belly fat is we need to eat whole foods. We need to eat healthy foods that don't contribute as much to obesity, to the inflammation in our system. And we know that sugar, specifically fructose, is highly linked to obesity, and fructose is in everything, it seems like, that's processed. So focusing on whole foods would be super beneficial for us to combat that. The other thing that we need to consider, and the bodybuilders have figured this out way before medicine was even really concerned with it, is sleep. Sleep in the studies shows that if we get quality sleep, we have higher rates of growth hormone at night, and higher rates of growth hormone dictate in turn to increase testosterone. So we need to avoid sleep apnea. If we're snoring excessively, if we're having periods that we're not breathing, we're not going to secrete growth hormone because of the excess cortisol and adrenal system kicking in to save our life because it thinks we're dying, we're being suffocated, and therefore we're going to get low testosterone. So we need to deal with that. The other thing that bodybuilders have figured out is stress reduction. And a lot of people that are professional will sleep a lot. Now, obviously, they're on stuff to help them, but even in the natural world, reducing that can help us do better. So the reason is, again, is we're reducing cortisol. Cortisol directly opposes growth hormone. So stress, getting rid of stress, can help boost our testosterone levels. The other thing that we need to do is exercise if we can daily. It doesn't have to be crazy hard, but something every day. Not only will it help us with our belly fat, we'll feel more motivated to eat healthy. Our circulation system will be better. We're going to reduce the inflammation and reduce cortisol, and testosterone is going to increase. The other thing in the studies that has been shown to a link for not just good health, but for testosterone is making sure our vitamin D levels are appropriate. I recommend blood testing. I did this in family practice all the time. Even some people are resistors. Even giving 10,000 IUs of vitamin D, I couldn't get their blood levels over 30, something genetically, or they're not absorbing it in the gut. So we would have to increase the dose to get them up near that 40, 50 mark that I recommend at the vitamin D level in the blood. And then the other thing is sex. So in men, erections are related to testosterone. So more, like I said, an indirect marker of whether we're producing testosterone, are we having 8 a.m., 6 to 8 a.m. morning erections upon waking? If we are, it does tell us that we are making testosterone. Now, so having sex causing erections can help improve testosterone. And that's all I got.